Hi, my name's Catherine, and today I'm going to teach you how to remove your drain. Generally, this is something that we do in the office, but if by chance you live out of town, out of state, and you leave before we remove the drain, this is something that you actually can do at home by yourself. In the very beginning, having a drain, you can accumulate a lot of fluid, and that's normal. That amount of fluid does usually decrease over time. To remove the drain, we would like there to be less than 30 cc's of fluid in a 24-hour period. For some people, this can be just a couple of days. For other people, it can be upwards of a couple of weeks. Everyone's body is different, and the amount of fluid you accumulate is different for each person. In order to remove the drain, peel the tiny piece of tape around the incision away until you can see a black stitch. There's a little loop through the skin, and what you'll do is cut that little loop in order to allow you to pull the drain out from the skin. The stitch holds the drain into place. We'll clip that little stitch, and we'll also release the suction on the bulb. What we'll do is remove this little plug and make sure that the bulb is open and full, not squished and flat. Next, what we'll do is pull on this little plastic tube. You actually have to give it a pretty good tug in order to remove it. I think it's more tension than you realize, so don't be afraid to pull on it. Most people tell me that it doesn't feel painful. It just feels like a wiggly worm, and it's a sensation that people aren't usually used to. Sometimes there can be a little bleeding or even a little gush of fluid that can come out after the drain is pulled. This is normal. Once we remove the drain, we want to pat dry along the incision, removing any drainage that may be residual around the skin. Make sure that it's nice and dry and replace the tape over the top. If you have any questions about removing the drain, feel free to call us at the office.